Sure. My name is Michael Polacek. We don't talk about issues here pretty much. We focus on the skill sets or the networking that's important in addressing the issues. So we talk more about how to get there rather than the issues. And that nurses become active, not just interested, but become actors in healthcare policy development. And that's the goal of this whole project, is to get as many people helping us develop a foundation for supporting people who want to learn how or improve the way that they are engaged in healthcare policy, whatever that looks like. And so, as you folks that are new, or if you haven't really looked at our website, that's our tunnel, that's our ladder to help people become more effective. And also along the way, if you know other people that may be interested, please share what we're doing. Thank you.
So Michael Polacek was the person who kind of ideated and initiated this cafe back in 22. And several of us have kind of joined on his bandwagon and said, yes, we need nurses to focus on policy and develop the knowledge, skills, ability, and confidence to engage fully in that. So that's why we're all here. And it's any nurse from any level in any setting who really just, it's a come as you are group mentorship, sharing space. And this year we focused on different skill sets as how we can become prepared to engage in policy. And on our thematic series here, we are ending the year with technology skills. And so that's why I am so excited to invite Jasmine Bonder here today. Dr. Jasmine Bonder will be talking about her transition from scrubs to startups and all of the policy implications that she's had to deal with in that whole transition. So Jasmine, please share more about yourself and what you're going to share for us today. We're so excited. Thanks so much.
First, it's so nice to meet everybody. Happy Saturday. Thanks for spending time with me today. I know we're calling from all around the world, which is just so cool. I'm calling in from San Antonio, Texas at 11 a.m. So it's such a beautiful Saturday morning to be spending with you guys. So I'm going to jump in, but I'm going to talk about myself kind of as I go along. So you'll learn a little about me and my quirkiness. Can everybody see okay? You can thumbs up or something or nod your head just so I feel confident in my tech skills. Thanks, guys. So a little bit of an introduction. So the technology in general has been coming into healthcare. We all see it. We all play with it. There isn't a day that you're not touching something that is related to technology, whether it's EHR systems, whether it's you're getting on the phone, whether it's communication, whether it's cybersecurity, or maybe it's an advancement in DMEs, so medical equipment, hardware, softwares, whether it's informatics. Really, I can name a list that we're all really integrated with. But something that I noticed early in my nursing career is that there's really two avenues that you can do to really propel yourself to be involved with technology. There's one, which is just advocacy, making sure we can get this stuff at the bedside. And the other is becoming an entrepreneur or an investor in companies that you morally align with and feel that will deliver really good care or enhance care in a certain capacity. So early on in my nursing career, I started becoming an angel investor. And I was really looking at dividing healthcare up into 4 sections in technology and really assessing from an investor perspective how I, and as a nurse practitioner, 12 years experience, what do I know that we need to do better at? And I don't really have the skill sets, but I know somebody in San Francisco who probably does. And so really started off my career doing this angel investing, meeting with different entrepreneurs and helping them with clinical advising, or just really helping out with funds so they can propel their startups into success. And so what I've really realized over the years, there are really 4 or 5 sections that I've noticed technology advancing. We have the big umbrellas, which is hardware, software, cybersecurity, informatics, and development, and then policy. But it's all really working for precisional medicine. We are really trying to be more precisional as a group, whether you're a physician, whether you're a nurse, whether you're ancillary bedside support. We need to become more precisional. We have now 2024, everything we're doing should be a data-driven reason and no longer subjectiveness. Training and simulation. Anybody use VR in their day-to-day or have used VR as a nurse? I highly recommend, if you are in nursing schools, to see how you can integrate it into your teaching modalities, or look at what they're doing with VR for mental health, and especially people who are coming out post-op, putting on these VR sets and help destimulate after major surgeries and make people feel more relaxed and help with the recovery process. I think everybody knows AI. If you don't know AI, put in your real quick URL, chatgpt.com, and ask a question. You'll be shocked of the efficiency that has given out. Data analytics. We know the integration of data just in emergency room has dropped, or had hospitals using analytics have seen 15 to 20% reduction in emergency room waiting times. My husband's an ER doc. He probably would hate that stat, but it's just true. Left without being seen rates. We know that because the minute someone clocks into our EMR system, we know if you deliver care 5 to 7 minutes from their begin visits, you can reduce their mortality a significant amount. And another one that's pretty cool is blockchaining. Does anyone know about blockchaining? It improves patient record security, ensured safe data sharing while minimizing breaching. And so think of it really just blocks on blocks of data that is being inputted and exported in a certain way, so we can minimize any type of infiltration or like ransomware really happening to our data. So this is all kind of happening either directly with you guys or behind the scenes at the spaces that you're working at. But I know it's becoming very popular with transactions because it's a 1-to-1 ratio. If you look at large manufacturing companies, they use very similar methods where it's like they know that if they're supposed to get a fleet of 500x of something, that they should see the transaction be 500x of something else. So the blocks actually have to match each other so they can carry these large data. So it's the same idea with cryptocurrency, that if they're having these large transaction of money or these cryptocurrencies, these Bitcoins, whatever is coming in is exactly coming out. So they can monitor this from a very like a high level perspective. And it helps with like better efficiency. And then they can just see that it's a constant equal balance. It's like, you know, very much a not expert way of explaining it. One of the questions that I get pretty often is, let me change my screen. The next one is like, hey, I'm interested in technology. I really want to pivot either out of the bedside or I want to work ancillary to the bedside. What's available out there? And you'll be actually pretty shocked of how many companies hire nurses that want to be able to deliver better care, better communication, better customer experience, better delivery. And I think nursing has the best background to do so. So I think you guys have seen telehealth triage nursing, remote patient monitoring nursing, telehealth nurse coordinators. Anybody work in those fields by any chance? An interesting stat I think it's important to talk about: by 2026, the demand for telehealth nursing is expected to grow by 19%. And that's based on the US Bureau of Labor Stats. We know that 35% of telehealth services connect patients, especially in rural areas, and we're utilizing different type of remote patient monitoring. We know that nurses using telehealth report about a 25% improvement in productivity. So from our administrative perspective, we know that people are working more like efficient in their operations. We know remote patient monitoring has reduced hospital admissions by about 20% for conditions like diabetes, heart failure, I know Grace mentioned, hypertension. Other aspects are expanding access to care. We're really able to get ourselves into these remote spaces and really be able to deliver care more efficiently. Many of these companies that you guys see on this screen hire nurses. Really, you will integrate yourself with different type of technology or different type of delivery, whether it's medical equipment, whether it's cybersecurity. So if you're ever interested, like, you don't necessarily always need to look at the hospital for opportunities for your employment. Please look everywhere. Nurses can really insert themselves everywhere. Obviously very biased because I just think we should go everywhere because I think nurses have the strongest background to deliver like best care, best communication. But I think other companies, especially Microsoft and Amazon, are noticing that we may not want to perform at the bedside, but we can still deliver and serve humanity in different capacities.
I have a question about your thoughts on the telemedicine.
Yeah.
Particularly what I found that with these these cafes or when we're meeting online in these Zoom calls, initially folks were thinking, oh, it's going to really isolate people. We're not going to have a good connection with one another because it's virtual, it's not real. And what I found that if I go to a staff meeting in person, there are 3 people talking and 7 people sitting there nodding their heads. And there isn't so much inclusion, right? There's not the same, it's the loudest person. And so there's a couple of things about the virtual approach. I think it equalizes the ability to speak. It creates more of it for a lot of people, a much safer environment to speak their mind than if you're sitting around the table with your vice president. Because now instead of that chair, you really just have this avatar almost thing, and you it feels a little safer. Not only that, I think participation is increased if you have patients, particularly probably mental health folks, that may be reluctant to go, or it's just too much of a hassle. This virtual connection, I think, allows more interaction and probably more honest interaction because there isn't that barrier of being face to face with a lot of people not feeling comfortable in person as more comfortable in this sort of distancing where there's this sort of what are your thoughts on that? Do you have an opinion on that?
Oh yeah, Michael, I have opinion on everything. I, so I'm very pro technology. I think it's cultivated a space, like you said, that is very, like approachable, very understanding. I'm a young mom. I have little ones, like less than 3 years old in the house. So I'm able to have this work-life balance that historically when I worked inpatient or worked at different facilities, I didn't have that type of space. And so it really, I thought, brought an opportunity for individuals who still want to meet people, who still want this social aspect. It's built this culture that I think does, like you said, bring the safe space for individuals. Whether it's participation, I think it depends what role you play in the company, if you participate or not. I've heard some really funny stories of individuals thinking that their camera was off, wasn't off, and they're mute, not mute. I think we all have a lot of funny like Zoom stories like that. So I think there's a little differences there, but I think ultimately it's here to stay. It's driven productivity so much, and I think that there's a reason for that.
Being able to have a conversation with an entity, whether it's a human or this AI, and maybe AI isn't there yet, but if I have some questions, I know when I go to see the doctor or my wife goes, if there's not a second person there, everything goes over your head as a patient. And so you ask the doctor some things, but I know that when my wife will come back, and I've heard this from other patients, no matter how smart they are, they forget to talk to them, or there's this uncomfortability with having that conversation, or they forget stuff. I wonder if there's an AI assistant that is able to connect with that person because they have literally access to the full weight of knowledge everywhere. Would that be, would that improve your sense of connection with the healthcare system, being able to talk to AI rather than read the fact sheet? I mean, if you've seen your ABS sheets that you go home with, they're not always very helpful, and there's never a place to ask in a safe place. I'm not sure anybody else has experienced that, but when you see a provider, a lot of times people are not sure or don't feel comfortable asking, and that AI might just make a safer place. And you may get different answers depending on how that provider is feeling that day.
I mean, I think, Michael, you bring up a good point about white coat syndrome, and how much, like, I think AI has eliminated. I mean, there in Q1 and Q2, nearly $500 million of VC funding went into AI healthcare because it really breaks down the barriers, but barriers from a social perspective, cultural perspective, transportation, like any social services perspective. And I think also communication. You'll be surprised how many integration we're seeing with EMR systems, where if you have, a question, you can answer chat box, and they make large language models so that they can already feed the answer to what they think is the best next steps to do. So kind of eliminating unnecessary visits, but also making, I think, conversations more easy to talk about them, especially in vulnerable populations that may not feel the confidence to just tell their doctor what's going on. I think like AI is obviously here to stay. It's here for operational efficiency. I think you will see it in almost every day of your life. I mean, every day somebody is doing something to integrate AI with our human experience. I think we have to accept it and adopt it, but know it's a tool. I think that's usually where I usually stand. I wanted to tell you guys a little bit about myself and kind of my journey. So I've been a nurse now for 12 years, always a nurse no matter what I do, whether I'm practicing at the bedside or I am doing startup work. I always represent who I am at my base. Really where I started doing some angel investing when I was a nurse practitioner, and I was an ICU nurse practitioner during COVID. COVID was very hard on me and my husband as emergency room doctor. So our lived experience was very challenging during COVID, just like I think many of ours was. And I realized I was advocating for policy change. I live down here in Texas. We have a lot of preventative medicine gaps in care. And I felt like my voice wasn't going anywhere. So that's where I really pivoted into going into startups and helping build startups come into these rural spaces and really hopefully make a difference for individuals who may have never seen a healthcare provider before and make it more operationally efficient. Really started my background off in the ICU, but then started helping different departments in the hospital. I started, I just like to stay busy. So I was on the informatics team. I was on the policy team. I was on the guideline team. I was the hand hygiene team. And I realized I kept gravitating towards technology. And so then I started to do the big jump. I started just applying to jobs. And now I'm head of clinical care for Aidaly, which is a tech startup out of San Francisco, specializing in family caregiving and making sure we leverage technology to support family caregivers at the bedside. I laughed making this slide because I wanted you guys to learn a little bit about me. I have very low tolerance for things or for individuals not receiving adequate care and best care, whether it's a patient or it's society. I have very little tolerance for disrespect and really negative, things towards individuals. We're all human and going through our lived experience. So I think you have to be patient with everybody and understand where they're coming from. But I would say the quality that speaks to me the most is determined, always determined to really make a difference. No matter what I do, where I sit, where I go, I want to leave that nursing imprint, that Jasmine imprint, wherever I go. So I encourage you guys to do the same. You're very smart. We are all nurses. Be the difference. You are the difference. So be the difference. I'm going to just be done talking about myself though. So guys, on the bottom of your screen, you have reactions. How many of us have used telehealth ever? If you guys want to like put your hands up, or if you want to send me like a fun emoji. Cool. It looks like everybody has. How many of you guys used it today? In full spectrum of telehealth. So if you have Apple Watches on it, guess what? You're using telehealth. If you looked at my chart today or your emails, guess what? You're working with telemedicine. So probably a lot of us. And what's really interesting to me, like I said, in Q1, Q2, so much entrepreneurship investors went towards telemedicine. And then we knew that almost 42% of low-income adults face barriers in accessing telemedicine, like before this big AI boom and telemedicine boom. But it started to bridge the gap by 20 or 30%. But I think there's also something to recognize is like the equity efforts that it's trying to bring telehealth, that everybody has the access to care. So we saw this huge, I think in COVID, this huge organized but unstructural chaos to who's going to get to all these individuals now that it's reimbursable and that they can make money from this. How are we going to start integrating telehealth in all these communities? And so there's all these like long-term efficacy studies that we have from COVID, back from 2020, discussing, access to care, access to enhanced communication, eliminating transportation, better follow-up with care, quantity of individuals seen. Guys, what am I missing from this? How did telehealth impact the US population? Give me your thoughts. Guys,
I'm gonna take
continuity of care. You didn't have to miss working with your health provider.
I'll have a hot take on its applications for insurance claims.
Ooh, say more.
So I know that some insurance companies have used AI algorithms to do like batch processing, whether it, and Obviously, the negative side of that is like batch denials. What I have understood is that, for example, if the AI is using keywords from provider notes, for example, if they don't have an exact word that is in the algorithm that is connected to an ICD-10 code, for example, they would get denied even if otherwise they should, with a human review, qualify. So I think the efficiency is there, but we have to do better to make sure that data in gets you better data out. So the better you put into the algorithm, the better outcome you have to actually make this more efficient rather than creating more holes and gaps. And I think that's where nurses can come in.
So every single insurance company, at least the big large ones, like you're talking Humana, United, Anthem, Molina, they all use AI for billing. It's very, very much whatever you're submitting will pick up. Just like you said, it's happening today. I'm in the home care, home health space. So everything that we do, we know that is coming in and out from an AI algorithm, an AI machine. It helps with operational efficiency for sure, but I think you are also identifying the issue is that there is a gap in this and things are going to get missed and who's oversight. So we still need that human component. And I'm not sure if, I don't know the internal, organization structures of the billing for health or for payers, but I'm sure that they still have some human oversight for this. There's a lot of money to be billed, and I think that they always want to look on that side.
And I guess the way that relates to like telehealth is, for example, if you text your doctor, sometimes you're going to get charged, sometimes you're not. So that's just kind of how it ties into the telehealth part of it.
Yeah, totally.
Do you think that, well, there's a lot of benefits from this, depending on your background or your age or your generation, the telehealth can actually be a barrier. If you try and get into, if somebody doesn't know their phone well, you get to be a geezer like me. Apps are the only way to interact with the system. And if you're not really good with it, or my chart looks like it was put together by engineers and not by humans, you can't really navigate it well. It actually becomes a barrier because oftentimes there are no alternatives. If you don't have your phone, you don't have an app, sometimes you can't interact. And so they don't allow for people to engage in a different way because now everything is going that way because it's so much simpler.
I think that brings up like two really good topics. The first thing that you've said, Michael, that there are a lot of software as a service applications now out there. The SaaS model is like over flooded, I think, in healthcare, where everybody wants you to download an app and then now you get all these services. But I think one of the biggest thing is that the app market is flooded. People don't want a million apps on their phone just to be able to get care. And then B, you're assuming people can download, understand the process of download, and can open it. And then you have all these barriers to be able to get that services. And so I think, like you said, like we need to really bring this human element for care. There was this like wonderful company out of California who did everything based on texting because they served primarily an older population who did not want to download an app. They didn't have smartphones. I mean, this is a big reality. And so everything they did was based on texting. They would send you a text up of follow-up care, text you up when your labs were due, text you a lab when your medications were due, best practices. And I was like, that modality is a lot healthier for the serving population and practical versus getting them to download an app. Most of them didn't have even smartphones, at least who they were targeting. So I think that's one. And I think two brings up really my next discussion is the drama behind telemedicine. So you guys really talked about the cybersecurity issue. This is very, very real. I don't know if you guys ever, for fun, this is kind of how I a little bit nerd out on the weekends. I'm going to actually read it to you guys, the website. If you want to know how many times we've been attacked or been attacked like a cybersecurity attack or a ransomware attack, the U.S. Department of Health and Human Services Office for Civil Rights, it is a list. You can look at it online. Will tell you how many times in the U.S. our medical information or health information has been attacked and by who and from where, if they're able to identify it. And I look at this list probably weekly because the rates are exponentially growing. And so if you have a HIPAA attack in your or HIPAA breach, high-tech breach in your company, you are mandated to report it to the Office of Civil Rights. And if you ever, I really encourage to look at this list. You will be shocked of how they got targeted and likely how your information got out there. And so I have like looked over the years, the rates are like rising, like literally like this exponentially of how many breaches we're having. But more into the drama of telemedicine, right now is really critical in the telemed world because there is controversy if we should still reimburse telehealth. And do we still need in-person evaluations for care? And then what modality gets reimbursed? Do text messages, do FaceTimes, do phone calls all count as a modality to get reimbursed? Does it eliminate jobs? What about tech literacy? What about serviceable and non-serviceable areas? Do we have to offer two modalities of care if they don't have a smartphone, if they don't have the ability to get on the phone to call you? Can a company be strictly remote? Do they always have to offer another option? And things like you guys also have mentioned, the cybersecurity concerns, like it exponentially rises having everything on an app. Is this like the efficacy of this? So the drama is very, very real. So I wanted to ask you guys like a group question. And I know not all of us are providers, but still in this context, if somebody texted you, let's say I texted you guys and say, hey, look at my rash. What do you think it is? Should you be able to bill for that service? What do you guys think? If anybody texted you, do you think that should be a billable thing?
I want to say yes if this becomes more of the way that providers are spending their time with patients, but I don't think that it should be considered the same level and therefore cost as like a full in-person head to toe, medication reconciliation, historical medical assessment, because you can only do so much in a text message. This is really just a Q&A that should be part of maybe like a follow-up appointment, but it does take time away from the provider. And these providers are already often, because we just don't have the workforce to take care of all of our population's issues, providers are already going home, spending nights and weekends writing notes. They don't have time to complete their work for their patients in the time that they're given to see their patients. So I can see how this would be a continuation of that.
Eleanor, do you think they should bill for it? So you took a picture of that rash, you sent it in. Do you think that they should bill your insurance for that picture? Do you want face-to-face contact with your provider prior to them being able to bill for it?
Yeah, I definitely think that the billing should be based on the contact with the provider, their professional services. But I think it's important to employ like advice nurse or
Great point. This is the drama. This is the drama. Like, do we get to bill for it? I know I see 2 hands up, guys. Feel free to come off mute and
I feel like it's a slippery slope because for nurses, we
Yeah.
do have that caring nature. We want to help. So if someone texts me at midnight and says, look at this rash, should I go to the ER? I'm not going to ignore it and unless I have the promise of getting billed, but I'm not a provider, but I just feel like it's a slippery slope and boundaries need to be made because at the end of the day, unfortunately, healthcare is like business.
Yeah.
And you wouldn't, a lot of times you wouldn't ask the same of other industries or sectors. And I feel like, I don't know, there's a compromise there, that kind of what we've been talking about, but we also do need to be valued and respected of our time and our knowledge and everything. So I feel like yes, but boundaries.
Yeah, you went to school for 4 years. I mean, that is a value in itself. So if somebody asks you, even if it's a friend in the middle of the night, like you said, like, you went to school, like there's some value to that, like if you want your medical expertise, should it be billable? So as you guys can see, there's a lot of controversy. And then there's all these like hypotheticals, like if someone texted me now, even if it is a good girlfriend of mine texting me, like I went to school for 12 years, should I be able to bill for these text messages, So I wanted to bring some data points out for you guys to just, just for the brain to stimulate. So 50 states, all the states really do reimburse for video call. That was huge during COVID. That's the way that we were able to keep the public safe. 42 states reimbursed for remote patient monitoring. 45 states reimbursed for phone calls. 37 states reimburse store and forwards. So just if you came back to an individual and had questions about something that happened in the past and you're bringing it up, like similar to like a photo that you had, you can actually reopen it on their app or like whatever the modality is in the software, and you can bill for it. 38 states require exemption to licensing requirements, meaning that they don't want everything to become telehealth. There may be restrictions to what can and cannot be, which I think that's the healthiest approach. If someone has, having a heart attack, they should go to the ER. You should not be treating them at home. There are some exceptions to this. But the data is really, really prevalent. But I think, well, actually, we'll keep going. I'm going to go ahead and get started with the first question. You'll see it on your cell phones or on your desktop. If you don't, I'm happy to explain it to you. But please pick in what you think is right. In 2020, virtual healthcare visits in the United States will increase by how much? Oh, and hopefully you can see my screen. What do you guys think? All right, great. Answers are in. The correct answer is 154%. 154%. So whoever's picked 200%, you're very close. You're very close. In 2020, virtual healthcare visits in the United States did increase by 154%. Sorry that the wording was a little off there. All right, second question, y'all. How many health devices were used in 2022? Health devices, full spectrum, how many? So the answer, oh wow, y'all did good. 515 million in 2022 were the adoption of wearable devices in healthcare were 515 million devices in 2022. All right, last question. I know. If any of you guys teach, I really like this platform. It's fun to get the students involved and everybody together. So you'll just type it in. What was the most used online health services? Oh, sorry, I should have proofread this. What was the most used online health services? In 2023. WebMD. Okay. I like that one. I didn't even think of that. EHRs. EHRs. That's an interesting one because that's both patient-facing and clinician-facing. Video visits. Interesting. This one surprised me. And this is in 2023. Case management. Oh yeah, probably, but nope. All right, I'm going to take one more answer. Who else thinks they got a jab at it? This one shocked me. It kind of goes along with EHR, but it's like the second half of EHR is Apple Watches. Okay, the answer is in 2023, 1 in 3 patients used online services to order repeat prescriptions. So in your like My Health charts and in your like pharmaceutical charts, you can just press a button to have constantly repeat prescriptions. Isn't that interesting? That we've come to the point in healthcare that we can press a button and then we'll constantly get atorvastatin for the rest of our, doctor's prescribed ability. But that was the most used online services in 2023. Online health services. Anyway, y'all, thanks for playing a game with me. Sorry for the questions. I should have proofread them before publishing them. But just for the sake of time, I'll move us over. You guys can close the app. Hope you guys enjoyed the Slido games. Jumping back to what we were talking about earlier is just the concern of the breaches that are happening. In 2019, 49% of all reported breaches were hacking incidents. And then in 2023, that number rose to 79.7%. So all of you guys endorsing the challenges that you've had, whether your medical history, your identifiers are out there, this is becoming a bigger and global issue. There are so many companies right now dedicated to protecting your information. And now I know policymakers are now also looking at, is telemedicine making us more vulnerable and our health information more vulnerable? Next slide. Active threats, similar to what we talked about, cyber attacks. Are we protecting ourselves in all fronts? Alteration of data. We can really change people's medical history and demographic. AI has shown that it can do this, especially if it's integrated in the EHR systems that people are building, like software systems. And then communication, like, has AI influenced the accuracy? Is there lack of evidence-based practice now? People are going to ChatGPT for their DNP projects. I don't know if you guys have heard that drama, and saying like, type me a paragraph about whatever your DNP project, it's building it, submit it. And now when as a professor we're reading this, we're like, I don't know if this is really accurate. So this is becoming very popular, or as an active threat, unfortunately. So really the target, tech has been going in all directions, both good, bad, and ugly, the rose, the thorns, and the gray spaces. We know it's here to stay. We just now have to figure out what we need to do with it from a political standpoint. And what does the public feel comfortable with? How much do we need to be sharing, and how much software really needs to be integrated in our life to optimize care and care delivery? And so there is this gentleman. I don't know if you guys have heard of him, Buddy Carter. Anyone heard of him? Anyone acutely aware? Anybody live in Georgia? No. Okay. That's okay. So the Telehealth Modernization Act of 2024. So the goal of this is really to expand for provider eligibility, eliminate geographic restrictions, have some flexibility when it comes also for individuals who have disabilities to be able to get onto telehealth platforms to receive care. Extension of waivers. So this really extended waivers allowing through Medicare coverage, and then encourage telemedicine for chronic and specialty care. So I always like, it humors me sometimes in the policy world. I always like to know what people's backgrounds are and if they're qualified to advocate for such a thing. And so he is a pharmacist. He pretty much, his career has been really incredible with, medicine and trying to get easier medicine to the bedside. I know that this bill was introduced during COVID. Right now it's supposed to end. So we're all like waiting in 2025. It's going to get extended. It was only really allotted from like 2023 to 2024, like really post the COVID, heightened COVID pandemic era. And now we're looking in 2025 if this bill is going to get pushed forward. Highly recommend if this is something you're very passionate about. If you have technology integrated in your job, please email him and tell him, endorse why you like or dislike telemedicine and what your benefits, concerns, whatever they are, so they can support this while they make this legislation. Anyone have any questions regarding him? He's really interesting. No, that's okay. I think some areas that have now started specializing it, we see a lot of government bodies becoming more advocates about policy changing, supporting local campaigns, public health officials, active in local regional boards. Like, I highly suggest to be involved. Technology is taking over healthcare. We are part of this like health tech boom. So get involved with it from a local level. Organizations that I have been involved with over the past few years are what you'll see in the middle. The American Nursing Informatics is just like a wonderful group, really strong backgrounds of anybody doing informatics, software, hardware. So, really great group. Also here, there are some VC firms. If you are interested like in investing and being more on the entrepreneurship side, these are ones that are really, really big in the community, all dedicated to investing money into health care, health tech, health delivery. So please get yourself involved in these. Highly recommend it. I think getting involved in organizations is also a really good place to find your community. So you may be thinking how much is this really going to influence us? We know that the telemedicine market in the US is expected to grow from 53 billion since 2022 to 131 billion in 2028. So if you see that number and the margin between those, that means it's going to impact every aspect of healthcare. $131 billion business is going to impact every aspect of healthcare. The number of employees that are going to be offering telehealth benefits are going to increase from 79% in 2022 to over 90% by 2025. And then similar to what Nina was saying about AI, the global telemedicine AI market is expected to grow by 40% annually between 2023 to 2030. So we will see improvement with diagnostic accuracies, personalized care delivery models. So this stuff will be in everyday life, and it's really up to you guys if you want to be involved with it and how you want to mold technology into our care delivery. Sorry, guys, I know I'm at time, so I'm just trying to be mindful of your guys' Saturday morning. I think step for success, there's so many ways that you can get involved. I think being here today, that means you are involved, you are interested. This is a goal of yours. Really find your passion. There's so much you can do in technology. Find what makes you happy, and strive for the best. Be determined to be the person who makes the change, and whether it's a company or a company that you own. Watch out for the 2025, 2024 policies that we're having. It's going to really shake up healthcare if this bill does not pass. Watch the economic impact of telemedicine. It'll tell you where the market is going. Unfortunately, healthcare is a business, and so we need to recognize the economic impact technology is going to have on us, for good, bad, and ugly. I know Michael brought up the workforce and how it's going to change the workforce layout. We will see this, and being a part of those data, I think, is important. I think it builds really good community, and I think you're really going to be on a driver of change if you're involved with any type of technology. Last slide. What can I do? What thoughts, what questions do you guys have? What could we leave today with you acknowledging or disagreeing, questioning? What could we leave today with?
I wouldn't be sure how to learn more really and get involved with any of these things that these entities you're talking about. I wouldn't begin to know. I mean, besides maybe looking things up, Googling and starting to research it that way. How does one even?
I mean, Eleanor, I think that's a great question. I think that everybody brings a perspective that will enhance technology. And even going to any of these organizations, you'd be surprised at just like the demographic that's brought in, with people saying, like, resisting some of the changes, saying like, hey, we need to be patient facing. Humans need to be patient facing. Technology does not need to be. And really advocating for that. And then there's individuals who are like, you never need to speak to a human. You need to type in a computer and boom, you get all your problems and answers from them. So I think there's always a place. I think there really is a space for everybody in this health tech boom that we're having. It just depends on what lane you're in and how you want to change it. Grace?
I would agree too. It's kind of, Eleanor, the same way that we think about in the cafe here, finding your why, finding your passion, and how you get started is just reading, looking it up, being curious and writing about it. And it's not like there's just this one place that you go to, like nursing school, you find all the answers and then you go forward. It's really just, getting rather maybe have another healthcare focus, put your finger on the pulse, just start to read, start to listen, pay attention, and you will learn as you read. But we do have to make sure that we find those trusted sources because, as Jasmine said, there's already so much drama. We want to make sure as nurses, and taking a policy focus, how do we not stay behind? Because if we don't lean into this, we are going to be a generation that becomes obsolete. We have to lean into healthcare innovations, including AI, but we have to, using our nursing, mind and curiosity and critical thinking, how do we best use this so that we take its efficiency, but also make it effective, and effective for the right persons in the right places in an equitable way. So for example, we were talking about like rural access or increasing access through telehealth. I had put in the chat, a lot of the times we're talking about using these apps and having this digital literacy and the insurance to be able to be billed for even just a simple text message. Whether or not we believe that's the way we should go about it, do we even have the insurance that would accept that? Because if we're really looking at increasing access through an equitable lens, is it really the people that we're helping who are the most rural or who cannot go to a hospital or provider visit outside of business hours, or who have the literacy to do a virtual visit, or to even have a phone with data that can access the app. Are we really making it easier for the people who already have that access, or are we really expanding the access in an equitable way? And I wonder, Jasmine, if you think, or what your thoughts are on blockchain specifically to increase that. Like, I'm thinking about a health passport. I don't know a lot about the technology behind blockchains and whatnot, but I do understand that essentially the idea is no matter what its application is, whether it's cryptocurrency or an airline ticket or whatever it is, if it's your health record, that should be able, blockchain technology, for example, should be able to follow you around and be interoperable to be shared wherever you get health services. So thinking back to the equity lens, for example, if somebody does have a smartphone, and if they have the access to a network to connect, but they're a migrant because of climate change, they've been forced to migrate from one place to another, can they use that blockchain technology to have a health record with all of their information that they can digitally take with them from one country to another or one region to another to have that continuity of care? These are the kinds of things that I consider as a nurse. How can I improve services or policy for services to make things like this happen? So just any kind of thoughts that you have on that, I would love to hear.
Yeah. So two things. I think I love what you've started off with. I think it's like a privilege that we're all here today. We all know technology. We all just got on Zoom and we all just communicate each other. I see, 9 like very intelligent nurses here. We're all here today, but like we serve humankind that doesn't have the same privilege to sit on a computer and talk about really deep discussions about world concerns and health equity. So that's one component. I think we always need to recognize that as nurses we have a different privilege of understanding the medical landscape versus who we're serving may need those type of education and support. I mean, I think that's why we all went into nursing. And Grace, to your question about blockchaining and encrypting patient data, securing data exchange, I think that is like the theory behind blockchain, that we could transport this data from place to place, from EHR to EHR, and it would follow us. But then you're assuming the data going in is absolutely correct and accurate. And I think that really influences the actual technology. It assumed that a blockchain is 100% correct. You have the correct diagnosis, you have the right medication. But what if something is wrong and something was inputted incorrectly? We won't be able to remove that as we transfer to system. And so I think that is I think that's the large concern why we don't currently have blockchaining in healthcare or with our EHR, because the concern is if there is incorrect data that may skew our diagnostics as clinicians in the future. Especially I think when we go from country to country, the differences in standards of best practices, standards of educations are differences. I think that's a bigger issue, the standardization of education. I think that becomes challenging. I think in an ideal world, that's what we all need, this like passport of like, this is everything you need to know about me. But what if we had a standardized EHR? One EHR that we all go to, that we all use, so I know exactly where you've been, the last 12 months and who you've been seeing and what has been prescribed, right? But does that send us into socialized medicine? Do we need to get all the infrastructure behind that to be able to have that? And so you bring in like really heavy discussions by saying, let's just standardize healthcare, right? And just have this blockchain of all of our history go from place to place.
Yeah, and that's also, the discussion between finding the balance between public and private organizations to support this, because a long-standing, thought is that private healthcare companies are where the innovation comes in, because they're not restricted by regulations for that kind of innovation and scale. But to make it accessible equitably and this in the same way for same people, we have to get some kind of regulation in there, usually from a government institution, to have that interoperability. And that's why I shared the fast healthcare interoperability resource that's from the Health and Human Services here in the States. So we have to find the way to harmonize that, because they both have to be integrated. They both have to work together. And this is multi-sectoral. This is not just the healthcare field. We have to have our lens as healthcare providers, but for example, we're not the blockchain experts. So we need the blockchain experts to come in. We need the regulatory experts to come in, et cetera, et cetera.
Yeah. So I think that talks about like, when you bring those topics up, like I think in an ideal world, everybody wants this. We need efficiency in healthcare. I think also previously I worked ER, ICU. Sometimes I'd be like, where have you been for care? Like really where? And so you see these patients who get lost in the system. And why don't we have like our finger on the pulse with this? Like, why are they the first time seeing us as in the ER and we don't have any history of these individuals? Especially with really chronic and crippling diseases that we're seeing. I mean, the population is sick. I live in South Texas. The population is very sick and we don't have a lot of funds going into primary care. And so how do we change that narrative? How do we leverage technology to help capture these individuals and not leave them behind? So yes, we're advancing in AI, but we can't forget the people who can't use AI. That's a large portion of the communities. And so how do we bridge those two? That's where I think nurses are the best to do things like this. Bridge care delivery, find care solutions, and remember who we're advocating for. We can't forget this while we're sitting in these C-suites. Why did we come into nursing? No matter what clinical innovation that's there. I think we have an hand up. Is it Anji?
Yep, or Angelique, either one. Again, we kind of, Grace kind of mentioned this and you did as well. First of all, thank you for this presentation. This is one area that I know that I'm not necessarily weak in, but I just haven't educated myself on past nursing school. So, and it's obviously extremely relevant to so many different spaces. So thank you very much for educating us all today. But no, again, we all kind of bring our own background and history, and it does apply to so many different areas within nursing. So again, I'm going to center on environmental health. But I found this, so this is where I've been seeing as far as the impact of AI and technology in my network is AI and environmental health impacts. And so just to kind of summarize this article a little bit, and I'd like to hear your thoughts as well, as far as the pros go with reducing transportation to healthcare settings to access, care with telehealth and everything. It's a really big improvement, but it can also help with monitoring the environment and help governments make more planet-friendly choices, enhance efficiencies, detect oil and gas installations when they vent methane. So there are a lot of pros for sure, but right now I feel like the cons as far as the environment go might outweigh it in that with AI generating misinformation about climate change, there's a lot of water usage to cool these servers. And so it promotes in some ways water scarcity for some people don't even have access to, clean, safe water as it is. And then also just the energy needed to power these servers and everything. There's a statistic in that article there that says that a request made through ChatGPT consumes 10 times the electricity of a Google search, according to the International Energy Agency. So I feel like at the end of the day, it could also be an equity issue in that if it's not scaled up effectively with environmental impact in mind, then these advancements could essentially continue to contribute to GHG emissions, water scarcity, and the just climate justice idea that it'd be harming the health of those that contribute least to climate change and those that are who are probably not the ones accessing the technology to improve their health outcomes anyway, if they're not able to access it. So just thought I would introduce that lens to the room for discussion.
I love that you brought this up. I love that you brought this up because I had a healthy argument with someone this week about this. I want to show you this. I'm going to change my screen over. Maybe you guys will be able to see it, of how much AI, the energy consumption that is needed to be able to power AI, both from the US perspective and globally. And I just finished this wonderful class from Columbia this semester talking about climate change and its impact on our health. And they brought this topic up about how much AI it needs to be able to work efficiently and how that poses a threat to our current environment. You guys can see my screen, right? So just look at this graph. Like this is before AI, this is how much energy that is needed. This is US with AI. Now, like that's only just a small percentage. Look at the rest of the world. and how much energy is needed to power the AI. So sometimes I get a little worried when people are like, AI is going to take over the world. I'm like, no, it's not. We won't have a world to live in. So, I think it's something to just consider. I know this is very shocking. I had an argument this week with somebody about this, that it can't be AI everything. We don't have the energy to do so, and we will see the impact in our environment. And we already have such problems with climate change. I know in Texas, we have a just horrible issues with climate change and climate awareness in Texas and some of these areas. So the fact that you can't just build out all these data grids everywhere, it's not going to happen. We're going to have more destruction in our ozone, and we're going to see this from an indirect perspective. So keep that in mind when people are arguing that AI is going to take over everything. No way, no way. Our planet can't handle it. I'll drop this this article in the chat.
I just want to quickly say thank you so much for this presentation. And
yeah, thank you guys. Happy Saturday. Thanks.
Thank you so much, Jasmine.
Of course, my door is always open. I love to chat and I love connecting. You guys are always welcome to call, text, email me. I've been getting more involved with like building my entrepreneurship background and policy. So this like really aligns with what my goals are now, because I think they merge together beautifully. Yeah. So thank you, Grace, for setting this up. You go, girl.
Yeah, no, thank you so much for coming on and sharing. I love seeing all these different perspectives from so many people in my, lovely colliding worlds. But speaking about staying connected, this is one way that we're really hoping we can keep this ever-growing global community connected of people who are interested in nursing at the intersection of policy in whatever that means to you, wherever and whatever setting. So if you go to our website, this global cafe is in the top right corner. This is just like a free, easy map where you can place your pin on our map to show where you are, what your experience is with nursing policy and entrepreneurship in the sense of an undertaking of these policy things, where you are on the map and what you're interested in, what your experiences have been, so that we can connect with each other to learn more and find out more and understand a little bit more of the global landscape as well. It's a really strong, great way to see who's out there, who's interested, connect with them and learn from each other, because this is a safe and brave space for group mentorship as a know one, see one, do one learning setting. So please add yourself to this, share with your friends, explore all of our other resources for our development. If you click on development, this talks about all the different skill sets that nurses need in this space to address policy. We've had a speaker and a blog written about pretty much every one of these topics in a theme this year. So thank you so much, Jasmine, for contributing to the technology one. There are links here to different resources that can help build our skills in each one of them. So whichever one you feel like you're lacking in or want to improve on or want to learn more about, not only go in here and access the resources, but share. This is a collaborative project. This is not my project. This is not Michael's project. This is our project. Share resources that you think might be helpful, that are issue agnostic. So it's helpful for anyone in any space, no matter what their passion or pain point is, but different ways that we can help each other learn and grow in this space to be more effective in addressing policy.